Hello, this is Dr. Akin, one of the junior doc working in this department. Before we begin, can you have a name and age, please? I'm Andy Smith. I'm 30 years old, doctor. Okay, how would you like me to call you? Call me Andy. Okay, Andy, how can I help you today? Okay, the thing is, I went out to a restaurant with my family and with my wife and two children, but I suddenly don't remember. Maybe I fell down. As per my wife, I woke up inside the ambulance. I'm so sorry to hear about it. So, can you please tell me what happened before the fall? Actually, I can't tell you exactly. Like, I was having time with my wife and family, but suddenly all things went out black. Okay, I see. So, did you miss any meals before the fall? Did you miss any meals on that day? No. Okay. And did you feel any sort of sweating or abnormal movements of your hands and feet? No, doctor. Okay. So, did you lose consciousness? Yes, doctor. For how many minutes? Or how much? For how long did you lose your consciousness? For 2 minutes. Okay. So, when you woke up in the ambulance, did you experience any headache? Yes. There was no headache before, but now I'm experiencing this tremendous headache. Okay, I see. So, can you tell me in which part of the head the headache is? It's all over my head. And is it the same or is it getting worse? It's getting worse. Can you rate it on a scale of 1 to 10? Okay, it's a 6. Okay, we'll be surely addressing your headache in just a minute. I'll be asking you a couple of more questions. Okay, do you face any sort of weakness in any part of your body? Okay, no, no weakness. All right, and did you soil when you lose consciousness? Did you wet your pants or soil your pants? No. Did you bite your tongue? No. Okay. And do you have any other diagnosed medical conditions like high blood pressure or high blood sugar? No. And oh, okay. And after the fall, can you remember what? Can you memorize what happened before? No, doctor. Actually, I can't remember what happened before. And did you feel sick after you experienced the fall? Okay, I've actually felt sick. I vomited once in the ambulance, doctor. Okay, I see. And so I'll be asking you a few more questions uh, about your life. Do you drink alcohol? Actually, doctor, I drink 1 to 2 bottles of beer on that day. Okay, and do you smoke? Yes, I smoke about 2 cigars per day. 10 cigars per day for the past 10 years. Okay, I see. So, anything else that you want me to know? Okay, no, doctor. So what are you amongst this? I want to know, are you on any medications? No, doctor. Are you allergic to any medications? No. Anyone in your family with these sort of illnesses? Actually, no. What do you mean? Any brain pathologies, any brain diseases? Anyone in your family with any no. Okay. And what's your biggest worry, doctor? Am I having some sort of hemorrhage in the brain? I see that you're worried about hemorrhage inside the brain. I will have to take a look over there. Right now, I would like to check and I'll let you know what I found out. Okay? Okay. I'll let you know. Okay. So the thing is, now I would like to check your blood pressure, pulse, temperature, saturation, and I would also like to check your temperature. In the meantime, I would also like to check the back of your eye and like to check inside your ear for if there is any discharge or not. All right? Okay. So I found out some discharge on the eye. So as you have told me, I'm a bit concerned about your condition because you said you had some headache right now, and you also can't remember what happened. So I'm just I would like to admit you inside the hospital. Doctor, I don't want to get admitted inside the hospital. Okay, I see that, but may I know why you don't want to admit inside the hospital? Okay, doctor, my daughter's wedding is coming up pretty soon, and I can't admit inside the hospital. Okay, so would it be all right if you hand over the responsibility to any one of your neighbors? No, doctor. Okay, so if we discuss it with your daughter about your condition, because your health is our number one priority, because if we don't do something right now, it might lead to something potentially serious, and I don't want that to happen. Okay, I see. So what do you want? If inside the hospital, you will be kept under constant monitoring, and we'll be doing a urgent CT scan, and our neurosurgeon specialist will review the CT scan, and they might offer you some sort of surgery if there is any sort of hemorrhage. Okay, I see, Doctor. But will I be cured or will I die? please don't worry about it. Our neurosurgeon teams are a team of specialists, and they are handling cases every day. They are experts, so they would handle it properly. In the meantime, we'll monitor you constantly inside the hospital, and if you feel any sort of increased headache or dizziness or any shortness of breath, please ring the emergency bell. Our team will attend you. All right. And also, I would highly suggest you cut down your alcohol drinking habit, because it might be a risk factor for if there is any hemorrhage, it might be a risk factor for that. Okay, I see. So thank you so much for understanding. I will also be doing some blood investigation reports, RBS function test, kidney function test, and I would also be doing ECG, so that I can check if there is nothing going on inside. All right, doctor. So and also, I would highly advise you do not drive when I return home. Please, when we discharge you home, please call one of your relatives, maybe your wife, or maybe your relatives who can actually drive you back home. Does this make sense? Okay. Okay, doctor, thank you so much for your cooperation.